Alzheimer's is a type of dementia, cognitive and intellectual deterioration that causes problems with memory, thinking, and behavior. The condition causes difficulty in the retention of information, especially short-term, struggle in recovering learned knowledge, and trouble in contextually placing acquired learning, people, places, and things. There is convoluted and dissociative thinking. This means there is confusion in inserting contextually people, times, things, and places. People's activities are affected because memories and thoughts govern their behavior. Dementia is a brain disorder that is marked by progressive and irreversible mental deterioration that seems to occur or affects some people as they age. The condition seems to develop slowly, and once the condition starts, it seems to exponentially exacerbate over time, consequently interfering with activities of daily tasks. Alzheimer's is not a normal part of aging, although the thoughts are. Everyone who ages seems to encounter some degree of dementia or Alzheimer's. It is true that as we age, we are not as cognitively responsive as we once were. However, processing information slowly and dementia are two different entities. Therefore, forgetfulness is not necessarily a form of dementia. As individuals age, the brain cells die and are not replenished as they were during people's youth. This means the effectiveness of the brain's processing information diminishes because of aging. Blood circulation is extremely important in replenishing cells, especially brain cells. As people age, their veins and arteries become less efficient as it relates to circulating oxygenated and deoxygenated blood. Arteries carry oxygenated blood and veins circulate deoxygenated blood. But these processes are extremely important to the proper functioning of our brain. If our brain cells need blood to be replenished, then we need to participate in strenuous exercise for the circulation of blood. As the blood circulates, we benefit several ways, including the reduction of stress. We should also understand exercising is the fountain of youth. If we want to look and feel younger, then we need to replenish cells through the workout processes. When we choose exercises, they have to be activities we can commit to and enjoy doing. Exercises have to be done consistently in order to be effective. Obviously, as we exercise, there is more circulation occurring because the heart pumps faster and harder. Multiple benefits occur, including metabolism bolstering and cells regenerating, which aids memory and clarity. However, as we age, we tend to slow down and rationalize why we shouldn't exercise or find reasons not to stay active. Nevertheless, God created us to stay active. Moses was over 120 years old as he led the children of Israel to the Promised Land. He was active until he was instructed by God to go up into the mountains to view the Promised Land, and then he was to be buried by him. Abraham was over 100 years old when he was instructed to travel up into the mountains to make Isaac a sacrifice unto God. He had no problems performing the sacrifice because he had the ability to follow God's instructions. The point is, God constructed us to maximally operate when we stay active. We are better entities when we operate as God intended. It is palpable that exercising is extremely important in combating the effects of stress, in regenerating brain cells, and strengthening our immune systems. There are no substitutes for workouts if we want a long and quality life. It is imperative that we follow God's design for the quality of life's sake. We must exercise. Otherwise, the intensity of stress will compromise our cognitive processing. Consequently, our capacity to learn, remember, respond to stimuli, and process information will be greatly affected. If forms of depression occur, which are known as chemical imbalances, seasonal affective, major depression, dysthymic disorder, cyclothymic disorder, or bipolar disorder, etc., the conditions have immediate effects on the brain. Nonetheless, there are also long-term residuals. People who have experienced types of chronic mood disorders and/or trauma seem to be more susceptible to dementia or Alzheimer's. Mood disorders deplete the neuroreceptors, hormone levels, serotonin, dopamine, melatonin, etc., which are responsible for our mood, cognition, and behavior. Those who experience mood disorders and aren't correctly treated with applicable modalities increase their chances for dementia. Treatment with pharmacotherapy or synthetic reuptake medication such as Prozac, Lexapro, Paxil, or Effexor, etc., seems to lessen the vulnerability to dementia. Why? Because the longer the conditions persist, the more the depletion of vital chemicals needed to elevate to homeostasis, chemical balance. The chemical imbalance that causes mood disorders and anxiety also leave indelible residuals called plaque or tangles, as well as other deprivations. Plaques are a deposit of protein fragments called beta-amyloids that build up in between spaces of nerve cells. Tangles are twisted fibers of another protein that builds up inside the cells. As people age, they may develop low levels of plaques and tangles. However, those with Alzheimer's diagnosis have developed far more. Some believe that plaque and tangles buildup are more genetically generated than caused by chemical imbalances. However, studies have not definitively substantiated the reasons for brain degeneration, or Alzheimer's. The deprivations responsible for dementia tend to develop in areas of the brain important for memory. However, as time progresses, the deterioration spreads to other regions in the brain, which affects reasoning, communication, and mood. Scientists believe plaque and tangle buildup greatly impedes cells communicating with other nerve cells, which affect mental survival. Essentially, once chemical imbalances occur, the residuals can develop proclivities for future vulnerabilities of cognitive and neurology damages. One may understand this by an illustration of how the body works. If someone breaks a leg, it will take time to heal. Even when breaks are set with braces, supports, and pins, the residual of the breaks may never fully recover. Even with the appropriate treatment and healing time, there may be some apparent residual weaknesses of the injury for years. Some sports figures who have incurred injuries never regain their abilities before their injuries. Some athletes may never fully recover because their injuries may have covert weaknesses embedded. Surgeries and treatments don't equate to healing to the same strength before the injuries. This is why individuals who have incurred long periods of stress, mood disorders, or trauma are more susceptible to deteriorating cognitive processing. The trauma of these aforementioned conditions can have a lasting effect on individuals' brain functioning, which can possibly promote Alzheimer's. Many times during stressful periods, individuals self-medicate with excessive usage of drugs and/or alcohol. The purpose is to mitigate undesirable feelings. What many don't realize is their substance abuse is not making their situations better. In fact, their abuse increases their susceptibility to the onset of dementia. Drugs and alcohol abuse increase neurological damage to the area of the brain wherein Alzheimer's is usually discovered. Alcohol is an astringent that the body and mind has to work to expel. When inebriation occurs, the chemical makeup of the substances causes the individuals to feel differently. The experience is occurring because there has been subjugation of the cells responsible for cognitive reactions. That is why people act and respond differently under the influence. But there are always residuals to the usages of substances. That is why many people experience headaches after drinking copious amounts of alcohol, or they don't feel like themselves after abusing drugs. The more one uses substances, the harder the body has to work to rid itself of its chemical effects. Please note the body purification systems, liver, pancreas, kidneys, etc., can operate effectively in ridding itself of foreign chemical toxins, but only up to a certain point. When abuse occurs, the purification systems become less effective and may even fail. Kidney failure, pancreatitis, or liver failure. And none of those are a pretty situation. Many people have abused themselves through substance usage into early onset of dementia or Alzheimer's. One of the greatest factors of Alzheimer's seems to be age. However, many people, around 5% of those with the diagnosis, start somewhere between their 40th to 50th birthdays. There are many factors to consider when individuals' memories start failing. Alcohol can contribute to poor memory, as well as drug use and/or abuse. Sometimes head trauma or other medical diagnoses can contribute to loss of memory. One thing for certain, age is not the only factor to consider when individuals seem to be besieged by dementia. Studies have found that trauma can greatly affect the neuroreceptors of the brain, thereby enhancing the likelihood of Alzheimer's. Therefore, trauma, such as post-traumatic stress disorder, PTSD, etc., and/or stress can be contributors to the Alzheimer's dementia diagnosis. There have been many people whom have been traumatized or incurred tremendous amounts of stress and never exhibited symptoms of dementia. However, research has proven many Alzheimer's patients were besieged by trauma and stress earlier in their lives. Although Alzheimer's disease develops differently for individuals, there are common symptoms shared by all. Keep in mind, people who are experiencing the symptoms may not realize they are repeating themselves, appearing confused, or are exhibiting agitation and anger. The self-awareness part of the brain has been affected by the disease. The most common symptom exhibited by victims is difficulty in remembering recent events. When Alzheimer's is suspected, the diagnosis is usually confirmed with tests that evaluate behavior and thinking abilities. What follows are brain scans and then examination of brain tissues to obtain a definitive diagnosis. As the disease advances, symptoms can include confusion, disorientation, irritability, aggression, projection, mood and behavior changes, trouble with language, reliving previous events, forgetting learned behavior, paranoia, suspicion, deeper long-term memory loss, difficulty speaking, walking, swallowing, and appropriately relieving oneself. As individuals are further gripped by dementia, they withdraw from their loved ones. Gradually, bodily functions are lost, ultimately leading into death. Alzheimer's patients operate, many times, for an extended period before family members conclude something is wrong and that the individuals need help. Since the patients can be cantankerous and challenging, family members find it less stressful to avoid rather than confront them. The family frequently contributes their behavior to old age or other peripheral circumstances. Oftentimes, by the time the family decides something is grossly wrong, the individual's conditions have worsened to severe stages. Families tend to operate out of denial because they don't want to accept that their family members have the disease. The individual, while driving, gets lost. They constantly lose keys, purses, and/or shoes. They also place items in inappropriate places, and they don't do well remembering people, places, times, or things. The confusion or disorientation is stressful for the symptoms bearers. For the Alzheimer's patient, their life is like living in a maze, never knowing where they are. However, family members are also stressed because they really don't know how to help. The effects of dementia, Alzheimer's, do not only affect the patients, but everyone who is connected to them. This means the stress of dementia is a family affair that overflows into the lives of each and every family member. Most researchers, medical professionals, and counselors have concluded that there is no known cure for Alzheimer's. Therefore, progressive caretaking is required as the symptoms worsen. Since taking care of Alzheimer's patients is stressful, family members need to pitch in to assist in areas where they can. Since caring for the patient is demanding, every family member should be willing to assist and not leave the caretaking responsibilities on only one or two family members. The patient, because of the condition, will likely protest and become angry as individuals attempt to administer help. Part of the resistance is due to the fact that they are unaware of the extent their illness has ravaged their cognitive capabilities. In other words, they are not fully aware of how their sickness is affecting them or their family members. Therefore, the caretakers need to treat their family members similarly to the way they would take care of babies. The members need to operate from where the patient is currently, as opposed to where he was previously, or projecting where he will be in the future. It is difficult for family members to see their loved ones struggling with the symptoms. However, tender love and care will provide the patient with some form of quality of life. Understand that even if the person is afflicted with disorientation or confusion, the patient can still relate to other family members displaying kindness, love, patience, and empathy. The intricacies of caring for a patient are extremely demanding. Therefore, knowing how to view the person's conditions and how to provide for his or her needs are extremely important. Remember, stress can contribute to the onset of the condition. Consequently, while providing care for loved ones, please provide relief for yourselves, and that includes exercise. The power of God will provide the correct tools to assist an Alzheimer's patient. Let's remember 1 Corinthians chapter 13, verses 4 through 8. Love is patient. Love is kind. It does not envy. It does not boast. It is not proud. It is not rude. It is not self-seeking. It is not easily angered. It keeps no record of wrongs. Love does not delight in evil, but rejoices with the truth. It always protects, always trusts, always hopes, always perseveres. Love never fails. So let's not let love fail as we provide care for our loved ones afflicted with the debilitating condition of dementia or Alzheimer's.